Okay. Okay, please go ahead and share with us your
Okay.
experience with the Ultra H2 bottle. Please go ahead.
Okay. Be doing this one for me. Showing you the disease conditions. Okay. Good morning, everyone. Good morning, everyone.
Yeah. Good morning. Good morning, ma.
Can
Please
I
go
be heard?
ahead.
Okay. Okay. My name is Mrs. Osita Henrietta. I retired from General Hospital after 33 years of service as a nurse anesthetist. I retired last year, September. And then before my retirement, I saw this opportunity and joined the Century 21 Freedom Group. I did not just come like that. Number one, I've been very sick, very, very, very sick, so much that I was fainting on duty. Prior to this time, my sickness came as a result of complications from birth. I had gestational diabetes and hypertension, pregnancy-induced hypertension, complicated by difficult delivery, waist pain, crippled for 4 months. By the time I started working, fast forward to after a while, I resumed work on wheelchair. Fast forward for many years, for up to 15 years. After that, and then I could not stand. If I want to stand, I will
Can
lean
you
on
be a
a
bit more audible?
couch.
Can you be a bit more audible?
However,
Can you be a bit more
okay, more
audible?
audible.
If your
Okay,
device can be closer to you, so that you can hear you better.
okay, let me increase the volume.
So increase your volume so that we can hear you
Okay,
better. You are doing very well, ma. Please go ahead.
okay. Can you hear me now?
Yes, it's better.
Am I better now?
Yes,
Okay.
it's better.
So that complicated, it went on to 2023, 24. So much so that my sugar became uncontrollable. No anti-diabetic drug was able to control my sugar at all the Nigerian made metformin and the rest, they could not control it. Even my BP, when I have 150, 190, that was a normal time for me. And then the sugar was always on 25, 22 in the morning. Although because of the work I do, I really did not have time because of anesthetic work and we are short staff. I didn't have time to be maintaining my diet, so I was just eating anything I see. So that made my sugar to be on the constant high side. However, when I came in contact with this organization, before I came in contact with this organization, when I'm on call on duty, about 2 times I've collapsed on duty after injecting a woman on spinal in the hospital, in the theater. Before they bring out the baby, I will sit down. The next thing I've passed out, I've collapsed. Then they will carry me and put in recovery bed, you know. And then it happened. They will now send for my children that night. They will come running up and down trying to get the foreign drugs I take, Triviamet and metformin. But but those drugs are very costly. Whenever I run out of cash and I cannot take them, you see me collapsing. My condition was so bad that when I wake up in the morning like this, I woke up as a surprise. I say, God, did I wake up? And then I say, God, thank you. I was never sure of living. When I woke up in the morning, I'll be alive till evening. My case was that bad because I may wake up in the morning, all of a sudden, I'll start feeling weak. I'll start feeling sleepy. I'll just take phone. After dressing, I'll take phone, lie on the bed, call my superior, Auntie Vera, please, I'm feeling sleepy. I want to sleep. Just give me 1 hour. This is operation day. I'm going back to bed. I come to work by 10, 11. It was my colleagues that were just covering me. If not, so I would have been shown the way out since. So, but God so kind. When I saw this opportunity, 2024 February, I joined. Not that I joined because I was invited, but I didn't see the need. I left until God came to a dream and showed me something. I was getting money. And then when they announced the day I connected to this, I just came on my own, just what they were doing in my hospital, I just walked in casually. And then while I was listening to what they were doing, I heard a voice in my left ear saying, "This is that rice. They whispered to my ear, this is the rice they showed me in the dream that meant blessings and so on, raw rice. And then while they were showing the number of accounts to number of people to join, they whispered again, do the highest. They said, do the highest. So without even understanding what I was seeing and what I just knew it was God. Because sorry, I didn't introduce myself as I'm a prophetess and an evangelist. So I hear God and I knew it was God. Without knowing what I was doing, I just obeyed God and got myself connected. I got connected with the mastermind selection. And then 2 months after, when I got connected, they gave me some supplements which were helping to control my pains and so on, because I have arthritis. Apart from hypertension, I have diabetes, I have arthritis. When I wake up in the morning, when I get up from seat, my legs will just wobble. I've fallen down before my doctor twice while consulting. I want to get up, I will just fall. So, and it has happened in pharmacy and other places so many times. So, and that was it. My left finger, this thumb was not able to come down or go up. Sometimes when it comes down, do bim, it goes up. I'll stretch it, do bim again. So very painful. I was seeing the orthopedic doctor who asked me to buy ball. I was pressing ball for some months. He didn't do me anything. They referred me to physiotherapists. That one spoke English, did whatever I did, nothing. Referred me to nutritionist. She said gout, I should not eat meat, I should not take this, all this. After all the English, nothing was done. Until I saw this organization, I entered this organization. They gave me some supplements. That one helped me small. But 2 months later, I came in contact with this wonderful hydrogen molecular water bottle. This bottle, as you can see it, I started taking it. Immediately, I generated it. I put on this point two. That's where I normally do mine because I need it to be very high. I put it on point two, drank it the first day. Lo and behold, my sugar came down from 25 to 15. I said, what? The next day, I generated it again. I kept drinking the whole day. Then the next day morning, I checked my sugar again. That's that now. The first day, the second day, it came from 15 to 8.3. I shouted because even with the Triviamet and the Novomix they were giving me, it's only when I take Novomix injection that my BP will come down, my sugar level will come down. But if not so, if it's just Triviamet, it will not come down so much. So I was so excited that I've seen something I can be taking. So when I don't have when I don't have money, as time went on, in fact, I stopped taking those drugs. I just those metformin that were not working or doing anything for me. I stopped taking them. So when I started taking this
I think Mama is having network issues. Of course, she's going to fix it, but I need us to be able to be patient and get the details. You know, it just shows you. It shows you. I think this is one of the most inspiring stories I've heard with respect to the powers of what the Ultra H2 can do, and also because she's a medical personnel, she's able to give details in terms of facts and figures. You know, some of the things she shared with me, I couldn't even, you know, I couldn't even, I, I couldn't even believe a lot of the things she shared with me. You know, it just tells you, but she's back. I think she's back now. Device is reconnecting back, and it just tells you what is possible.
Yes.
Okay, good. You're
So,
back. Please
so
continue.
even
We can
with
hear you.
those drugs that were not working for me, because the cardiologist the first time placed me on telmisartan. Telmisartan began to bring my BP down so much that it was even going low, sometimes to be 70/40. So, but when I started taking this hydrogen molecular water bottle, it was stabilizing my BP. My BP was not going up, it was not coming down. So my cardiologist said I should stop taking any antihypertensive drugs. Then for the diabetic drugs, I'm taking just the other ones that were not working for me. The metformin that was never working for me is what I just take just to satisfy myself. Being a nurse, I know that I'm not supposed to be out of my treatment, so I just take it. But this bottle, with this bottle, hydrogen molecular water bottle, is helping to control my BP, my sugar. As at yesterday, it was seven. The other day it was 6 point something, which I don't used to have before. So, and then I eat everything I want to eat. So I'm not telling you to go and eat anything, because you may not be able to manage yourself. I'm a health person. I know what to do when it goes up. So this is how I've been managing my life with this. Now it's not only that, then the arthritis completely gone. You can see me flexing. Why is it not showing much? Why is it not showing?
It's showing, man. I can see you. I saw you flexing. No, it's showing. It's showing. I saw you flexing your thumb.
Okay, you can see
It's
me
showing.
flexing my thumb. It doesn't,
Yes,
it
I saw
doesn't,
it.
it's not no more stiff. I've
Well, I think we're
I was
having
having status
network.
asthmaticus. So it's better now. So hello.
Okay, please go back to from where you were
Now
flexing your thumb
that
before you
asthma,
entered the status asthmaticus. Go
okay.
back to
So
flexing
it
your
went
thumb.
over.
We didn't hear you.
Now
Network. Yeah.
concerning the bottle, when I start using it, I am now okay. I am looking healthier. I'm no more having asthmatic cough. I've never been to admission again or fainted again as a result of high sugar, high cholesterol, high anything. And then after I bought the bottle, the hydrogen molecular water bottle, my grandson, the only grandson I have,
Okay, ma, please,
ate
before you go to
camphor.
your grandson, hello, ma,
Yeah.
before you go to your
Yes, sir.
grandson, please flex that your thumb again. Let's see. Flex your thumb.
See
Oh,
my thumb.
wow. Oh,
And this
wow.
is my knee. I can move my knee. I can flex. I can jump. I can do
Wow.
all my things. I can
Wow.
trade. It's no more paining
Wow.
me at all. Yes,
Wow.
it's no
Before
more paining
before
me.
you
I'm
could
no more
not
feeling
before
this.
you could not walk up here, right? You said before you could hardly walk.
I could
Before.
hardly walk. I could hardly climb upstairs. I'm
What
tired.
of jump?
Always
Could you
tired.
jump?
Yes, now
Could
see me
could
jumping.
you jump before? Before? Could you jump
No,
before?
no, no, no. I couldn't jump. I couldn't even walk from the ward from the theater to the ward to review patients was always a difficult thing for me. Most times I tend to bring
Wow.
the patient to theater, I'll review them on the theater table. So
Okay, you also talked about you had the status asthmaticus. As in, for
yes,
those who might not understand, that she has consistent asthma attack.
yes, I could not respond to any drug, any inhaler or any drug could not help me for a period of 7 months. 7 months I was having it during the pregnancy. And even after, even
Hmm.
before the pregnancy, each time I'm breathing, some people walk away from me because my breathing was always high and very loud. My family,
Hmm.
they call me pussycat. I'm only, that's how I breathe naturally. But
Hmm.
now it's gone. And I used to
It's
have
gone.
allergic rhinitis, a condition
Hmm.
whereby I was always using handkerchief. My nose would be dripping with catarrh. Then once I step into Jos or Kaduna, my nose will start dripping with catarrh immediately. But now it doesn't happen to me. I've overcome
Wow.
all those allergy, asthma, arthritis, hypertension, diabetes. All those things are under control. Then,
Wow.
then my grandson ate camphor. When he ate camphor, close that door because of the noise. When he ate camphor, his kidney, I was on call when they called me that uh, that he was bleeding urine. He was urinating bloody urine. And let me see. Where is my slide? I cannot show it. Okay. So it was, I have it on slide. I don't know how to show it here.
It's okay, ma.
I
Just
don't
go
know how to
ahead.
show it. The urine was bloody inside the pool. And then I said they should bring him on in the hospital. They brought him. By the time they came to the hospital, the urine changed from blood to Coca-Cola bottle. Coca-Cola bottle color, showing that the kidney was packing. I was very nervous. I ran, got Lexotan, I mean, yes, got laxis, doctor gave, and so on. They were running drip and so on. After 6 days, nothing got better. His test, all his kidney result, urea, erythroid urea and creatinine, the result were reading star, 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 meaning they were reading out of control, out of reach. They are not readable. And then the LFT, the kidneys also was giving issue. The kidney, everything was reading high, high. What should be 240, the alkaline phosphate that should be 240 was reading 840 something. Others were equally reading very high. So so the doctor called me and said, Henrietta, I'm sorry, we cannot help you. We are referring you to Babylada Teaching Hospital. Today is Friday, that's after 6 days. She said I should go home and prepare financially and otherwise and come back on Monday. So I should give me the referral letter. So we went home. I just stayed in the sitting room with the boy. I was on call. I put myself on duty with that boy, generating this water. If he eats, I will give him this water. Anything, that was what he was drinking Friday, Saturday, Sunday, Monday. Then and I took him back to the hospital to see the doctor. But I first entered the lab, told the lab people, please help me do these boys' erythroid urea and creatinine and the LFT. They did it. Everything was 100% normal. Not even by one figure did it go above or did it go lower. Everything was okay. And by the time I showed the doctor, they posted the result because they couldn't, they just showed me and they posted to the doctor. The doctor said, what happened? I said, it can only be God that I used this, but you know, they wouldn't want to hear that kind of thing. So that was how I left the case. My son came back
Wow.
home, whole and hearty. Up to today, he has never been to admission, neither has he had any kidney complication. My downline in Delta State also bought this bottle. Before he paid for the bottle, before the bottle came, somebody in his church bought the bottle and then used the hydrogen molecular water bottle and was giving it to somebody, one young man that has kidney failure in their church. He said he gave him for 2 months. On 29th of July, when we are involved, I don't know that name of that place, we had involved last year on 27th of July. I was there with Brother Ifeanyi when the phone rang. I picked the phone. She says, Henrietta, where's my bottle? See this bottle, see this boy that I said I'll be sharing my bottle with. Someone else is sharing with him. This is 2 months. The boy is now urinating. I said, do you mean I'm coming? Do you mean tom now? He said, no. He started making half bottle of Coca-Cola Coca-Cola bottle, quantity of urine. And later when I called him, when I was prospecting another person, I called him. She said he's making 3/4 bottle of Coca-Cola bottle of that urine. Later, the boy is making very fine. But from that time he was making half, they stopped putting him on dialysis. The boy is not on dialysis to date. Also, she called me that another church member of theirs there in Delta State want to buy this. Their pastor introduced the bottle to him, the hydrogen molecular water bottle to him, but they were skeptical. He said, wait, let me ask my consultant. She phoned me that should they buy it. I said, yes, I'm even researching currently on neurological things, and they said we can take care of it. Let them buy. Let them buy the bottle. So they bought the hydrogen molecular water bottle. That boy is 13 years plus. She called me to tell me that even that boy, after using it for some weeks, he's no more restless. He sits in one place in the church. They are no more guiding him the way they are guiding him. So because it works on the DNA and on the brain. So the bottle has helped him to get stabilized down. Then other people, right? Currently, I have someone that has lupus disease. In her own case, lupus disease is an autoimmune disease condition that will just be affecting the heart, the lungs, the kidney, anywhere you like, it will just start attacking it. The one that made me feel so bad is that it can even cause someone to start having unnecessary sore and wounds on the body. If my slide was here, I would have shown you example of it here now. So The woman was having sore in his left breast, bringing out water. I just generated 2 liters. That liter, she brought that liter they used to sell fuel, that 2 liters. I generated it for her and gave her. She took it for 1 or 2 days, came back and said that it's no more bringing out water. I said, this is good. Back to my own self, I just remember that I had a growth, skin tight growth by my left breast. It was so big as this, my thumb. It was small, oh, later it grew like this. By the time I started taking this water, on the 5th day, the thing became small like this, became very, very small like this. And then that day was Saturday. I took the water, went for program, came back. I went to see one of our retired nurses. She was not saying I'm shining, I'm looking younger. I said, yes, so it is this hydrogen molecular water bottle that I'm taking that even, let me tell you what it did to me. I had a skin growth as fat as this, but within 5 days, it came down to this level. And I took it today, this morning, went for program. On coming back, let me show you how it is. I zip down to show her. It was now like as small as the mouth of a biro. It shrank to like firewood. I said, what? This hydrogen water bottle is really what send it to do. I'm doing another thing I didn't send. So I also have some prostate cancer.
Thank you.
I gave this bottle, this
prostate cancer.
Hydrogen molecular water bottle. He called me a few days. He said, but God will bless you, 83 years old man. God will bless you that he can now pass urine freely. You know, I said, have you removed your catheter? He said, no, but that even with the catheter, he was not able to pass again. But it's now passing urine better than before. So I know that this bottle, hydrogen molecular water bottle, is doing a lot.
Thank you very much, ma'am.
I'm even having someone.
Thank you very much.
I want to start with you.
Thank you very much.
That is it. This is my testimony.
Thank you.
So I advise everyone to take this. You need it in your homes in case of emergency, with children, with anybody. This hydrogen molecular water bottle can support so much. Thank you very much.
Thank you. Thank you. Thank you.
Thank you.
Thank you. Thank you. Please let's appreciate Madam Henrietta. You did amazingly well, ma. You did amazingly well. I didn't expect you to do this much because of the challenges you faced initially. But let's appreciate her. Thank you. Thank you for sharing this with us. Thank you for sharing this. Congratulations on your health. Congratulations on your health. And I think without further ado, I'll be bringing this meeting to a close. But before then, hello, ma. I've muted you.
I saw so much of this bottle. We are selling of this bottle.
Okay.
Within 18 months, I became a millionaire.
Okay. It's okay, ma. 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 Thank you. I think you muted yourself, but it's fine. But it's fine. I like your energy. I can see the excitement. I'm happy for you. And you have more testimonies as you keep using the bottle. Okay. Before we go ahead, I think the right thing for me to do before I bring this meeting to a close is to take from my bottle.